A pleasant morning to our administrators and to our fellow employees.
Okay, I think you're on mute. Yeah.
Hi, good morning. A pleasant morning to our dear administrators, to
Good
our dean,
morning.
department
Good
heads,
morning.
and to
Morning.
our fellow employees, and from both Our Lady of Fatima University and Fatima University Medical Center. Welcome to our HMO Employee Benefits Program Orientation. Before we begin, let us ask for the guidance of the Lord through a prayer. Again, good morning. Another good news from our administrators, effective December 15 of this year. Aside from the usual employee discounts that we get from Fatima University Medical Centers, employees who responded yes to our HMO survey will be granted HMO benefits. And to formally open this orientation, here with us today is our EVP and CFO who has been working on this project since the previous year. Let us all welcome Mr. Don Oga Santos. Good morning, sir.
Good morning.
Morning, sir.
First, thank you for attending this orientation. We've been working hard for a program like this for all of you. As Kay said, this is our families and our administration's early Christmas gift to everyone. I know you have all been waiting for an HMO coverage that is to be provided for by Our Lady of Fatima University and Fatima University Medical Center for several years already. It's one of the most asked for benefits since we've had our FEMAC organization established. So, and finally, it has come to fruition that eventually all of you who enrolled in the program will be covered by this effective December 15. Um, we've gone through a lot this year, and hopefully this is a way of showing that if we stick together, and if we work things out, and with proper teamwork, we can have something done done, and something significant and something substantial can be accomplished. um, we hope, like in all insurances, we don't get to use this, but it's very good that we have something like this for our protection and our safety. So again, congratulations, and hopefully we can learn more about the program into this event. Thank you also to Howden and also to Coco Life for coming up with this, and also our HR people for putting up this orientation seminar. Thank you.
Thank you, sir. This program is another proof that our administrators really take good care of us, their employees. Uh, And we all know that this year is not the best year for us, but still this year we were given HMO, and that is something that we should be truly thankful for. Again, sir, thank you very much. So we have sent all employees a copy of the frequently asked questions, as well as the healthcare program summary and availment guide for your reference. So if you have any questions, you may use the chat box or the Q&A, and our speakers will be replying to your queries. And to tell us more about these benefits, we have invited guests from Howden and Coco Life. They will be introduced by Miss Ana Rose Bautista, or Miss Ara as we call her. So I will now turn over the floor to her. Good morning, Miss Ara.
Good morning. This is Kitin Aruga po. Miss Ara is on her way to our event sa may meeting sila in Batangas. So I will be introducing Howden and Coco Live. Okay, this is Kitin Uruga. Thank you
All
for the
right.
introduction, Ms. Kay. Good morning, everyone. I'm Maria Cristina Uruga, but you may call me Kitin po. Kitin Uruga from Howden Insurance and Reinsurance Brokers. This is a multinational company that provides consultancy and broking services for both employee benefits and non-life insurances. Our head office is located in UK, and our local office is based in Makati po. We have providing solutions for more than 4 decades now. With me is our team, CJ Ramos from our new business team or business development team, and Miss Ana
Yeah,
Rose
good
Bautista.
morning.
Yes. Okay, so today we are here for your benefit orientation, which will be presented by Coco Life team, Miss Sherry Mondihar and Manuel Victor Villar. So I believe the presentation will be handled by Miss Sherry. So without further ado, I'll turn over the floor to Miss Sherry of Coco Life. Thank you.
Thank you. Hello, good morning once again. I'll just check. Share ko yung screen. For a while lang po.
Hello, Cherry.
Ay, close to. Hello, yes sir.
Hello,
Ay, yeah,
Cherry.
yes, Vic. Go ahead.
Okay, ako na. Okay, sige. Hello, everyone. Good morning. So, my name is Manuel Victor Villar, and I'm from Coquelef Healthcare. So, basically, for this orientation, I will be discussing the benefits of the company with Coco Life, not only the benefits, but the availment process as well, and of course, the exclusions. So, for you to follow the presentation, so allow me to share my presentation material for you to follow my presentation slide, okay? Ma'am, can I share my screen po ba? I think someone else is using the screen po. Hello?
You can share your screen.
Okay. Okay. Hello again, everyone. So basically, po, I will be discussing the benefit of Our Lady of Fatima University with Coco Life. So to start orientation, first, let's start for the company's policy year. When did the company start the coverage with Coco Life? So basically, we started back in we will start in November 15, 2020, and as you can see, po, it will end on November 14 for next year. So we have a 1 year of benefit coverage with Coco Life. A gentle reminder coming from Coco Life Healthcare. So please take good care of your health cards because your health cards po will be valid for 3 years. So in the event the company po choose to renew with Coco Life, we will be using the same card po to avail the benefit coverage of Our Lady of Fatima with Coco Life Healthcare. So a gentle reminder also, your card po will be placed inside the kit. Inside that kit po, we can find two booklets. So one for the directory, the complete list of our hospitals and clinics po, and second, the manual guide. How to avail Coco Life Healthcare, and of course, we will be discussing this one, also the availment process of the benefits of the company with Coco Life Healthcare. So by the way, everyone, your card is for free, but if you lost your card, there will be a replacement cost of 200 pesos. So might as well for you not to pay for that replacement fee. So please take a good care of your Coco Life Health cards. Okay? Then let's have a quick look how big Coco Life Healthcare as an HMO provider. So by the way, as of the moment, we have more than 1,750 combined hospitals and clinics throughout the Philippines. So our networks is not only limited inside Metro Manila because this rosters of networks po is around the country. In line with that, we have also over 1,750 plan coordinators and more than 25,000 specialist doctors nationwide. So everyone on a monthly basis po, we are continuously updating these rosters of networks. So if you have a preferred doctor, okay, personal doctor, newly opened hospital and clinics po which are not yet part of our network, so we are open for accreditation. Just give us the names of your preferred doctor po or your personal doctor and their details such as contact numbers, which hospital they are working with, then we'll do the rest of the process of accreditation because we have a separate team who's handling the accreditation of our networks of providers. Again, on a monthly basis po, we are continuously updating our networks of providers. Okay, let's discuss our helpline. Coco Life Healthcare's medical helpline. So we are open 24/7. So even though that's holidays, that is weekends po, you can always reach these numbers. So again, beside from our landline numbers, we also have our cell phone numbers. And you can copy these numbers. You can take a clear photo of these numbers. You can write it down on a piece of paper. Keep it for emergency purposes. But a gentle reminder po, these numbers are also printed at the back part of your health cards. Again, guys, these numbers po are also printed at the back part of your health cards. And our hotline agents po are no ordinary hotline agents because these hotline agents po are all medical allied professionals. So what does that mean? So these members po of our hotline system are all medical allied. So some of them po are registered nurses, some of them are registered physical therapists, some of them po are registered pharmacists, and their current team manager is a doctor. So that if you have a medical concern, they can fully understand your medical concerns po. And all calls po are being recorded. So in the event that you want to go back with a certain call, you can always reach our hotline numbers po and ask them for the specific conversation that you want to go back to. Okay, so our medical helpline po, so we are open 24/7 to assist our valued members. Then, for the comprehensive benefit program, for Our Lady of Fatima University, we are covering members who are not more than 65 years old. So I think there's no member present in this orientation po who's above 65 years of age. None? Looking 65 everyone? Feeling 65? Okay, I hope you are all young ones. Young ones po ba lahat? So bata dati. So I'm just kidding po. So I think po we are all young ones po talaga. So below 30s, tama po ba? Okay. So our benefit for the company po is a maximum benefit limit. So for example po, our maximum benefit limit is 110,000 or let's say 100,000 pesos. So that 100,000 pesos po is on a per illness per year basis. So what does that mean po? So maximum benefit limit is a per illness per year basis. It means po that a certain illness will going to have a different maximum benefit limit po with another illness. I will give an example for you to further grasp what I'm discussing right now. Okay? So say for example, one of our members po incurred, let's say, dengue. So again, you're going to have a 100,000, again, example of maximum benefit limit for dengue. So that maximum benefit limit po can be used for confinement, okay, for consultation, for laboratory exam, or any availment related to dengue. So say for example, sir, another member po incurred different illness, say for example pneumonia. So that's another set of maximum benefit limit for pneumonia. Again, so that maximum benefit limit po again can be used for any availment in relation with pneumonia. Sir, next month, that very same member incurred different illness. Say, for example, again, UTI. So again, it's another set of maximum benefit limit for UTI. So again, everyone, I'm just giving examples po. So as long as your illnesses are not interconnected or correlated with each other, we're going to have a different maximum benefit limit po. But if your illness po are interrelated or interconnected with a different illness, if they do interconnect somehow, they're going to have only a one maximum benefit limit. So I will give an example. Say for example, sir, one of our members po for this month, let's say incurred hypertension. Again, if we're going to take a look back with the definition, different illness, different set of maximum benefit limit. So you're going to have another set of maximum benefit limit for hypertension. Sir, knock on the wood. I will give examples, but again, I don't want anybody po to have this kind of scenario. Say for example, sir, that member, okay, that illness ni member po, that hypertension, nakudabot wag naman po sana, for the next following week, resulted to stroke, so those two illnesses po will have one maximum benefit limit because hypertension po and stroke are interconnected or correlated with each other. Or maybe hypertension po is a complication that is resulted to stroke po. Okay? So whatever's your remaining benefit limit on your first availment for hypertension is the remaining benefit limit po that you can use for your next availment for stroke po natin. Okay? Our maximum benefit limit po is on a per illness per year per member basis, but the catch po is that as long as your illnesses is not interconnected with each other. Because if they do interconnect somehow, they're going to have one maximum benefit limit for those said illnesses po. Okay? So, benefit details. So everyone, I will be discussing the benefits of Our Lady of Fatima with Coco Life, not only the benefits of inpatient care, emergency care, and outpatient care and financial assistance, but also our availment process. So how can we avail these benefits po? Okay. So but before that, the manner of availment po natin for Our Lady of Fatima University, Valenzuela and Antipolo branch po. So inpatient care, again, please do take note because this is a very important slide po. For Our Lady of Fatima University po branches located in Valenzuela and Antipolo, the availment po natin for inpatient care, outpatient care po, and emergency care po, we will prioritize the availment process or the availment po natin with FUMC po. Okay? So, ipaprioritize po natin doon. So, yun po yung ating unang pupuntahan. So, if ER cases po, we can seek medical treatment to any accredited hospitals po or clinics po near the member, except po siya for major hospitals. You might be asking, sir, paano po pag ER talaga yung hindi na kaya? So pwede na po ba? Yes. You can now seek po treatment to any nearest clinic or hospital po in the area except major hospitals. So what are the major hospitals? For example, Makati Medical Center, St. Luke's Medical Center po, whether that's Quezon City or Global City po. The Medical City, yan po yung mga major hospitals po natin or Asian Hospital. So yung mga major hospital, except major hospitals po tayo. Okay? So we are going to prioritize our availment process for OLFU po, which branches located in Valenzuela and Antipolo. Okay? So we will prioritize the availment po natin in FUMC po. Okay? But for Nueva Ecija, Pampanga, Quezon City, and Laguna, inpatient po and outpatient will be availed into a Coco Life nearest accredited clinics po. Again, our availment process of outpatient care and inpatient care for QC, Nueva Ecija, Pampanga, and Laguna, our availment process po will be first our clinic. Okay, we will going to avail these benefits po in the nearest Coco Life accredited clinics po, or if there's no accredited clinic, the nearest accredited clinic po is hours away from the nearest hospital. Okay, for the nearest, when the nearest is hospital, of course we can now avail these benefits po in the hospital. But again, if there is a nearest clinic po within your area, our first availment po will be in the clinic po. So Our Lady of Fatima University po has no access to any major hospital, and FUMC po is the top priority hospital to be used po natin. Especially po, as I said earlier, for the branches of Valenzuela and Antipolo. Okay? So, outpatient care. So, what is an outpatient care? So, outpatient care po, this pertains to non-confinement. So, basically po, that includes consultations, laboratory exams, diagnostic procedures, first aid treatment for accidental injuries po. So, minor surgeries as long as we're not required to be confined, and pre and postnatal consultations po up to 14 consults. So, this is the part of outpatient care. The items that are not part of outpatient care are any prescribed medicines. So prescribed meds po during outpatient care are not covered, and any laboratory exam related to maternity. So sir, baka sabihin po ninyo, sir, you might be your discussion is a little bit confusing. As you said earlier, kanina, laboratory exams are covered. How come for maternity related cases, lab exams are not now covered? Okay, the reason is that because before any HMO can cover any laboratory exam of our members po, you must have a coverable diagnosis. And pregnancy po and maternity are not considered illnesses. So that is the reason po why any HMO providers are not covering any laboratory exam related to maternity except for the pre and postnatal. So again, this is the golden rule. Before we can cover your laboratory exams, you must have a coverable diagnosis. And pregnancy po and maternity is not considered an illness po according to our medical professionals po. Okay? So sir, how can we avail, okay, before I discuss the availment process, so some of the benefits for outpatient care which have inner limits po are flash on the screen. So warts removal are covered up to 1,500 pesos. Again, it is covered up to 1,500 pesos, not 1,500 pesos po. You might be confused. I'm just kidding. Okay, so we are covered up to 1,500 pesos of warts. So sclerotherapy, this will be for the varicose veins. So for example, some of our faculty members po are standing throughout the day. Then, it so happen na po na meron silang varicose veins. So varicose veins po are covered up to 5,000 pesos per leg per member per year. So if you're going to have your both legs po operated for the sclerotherapy, so that will be covered up to 10,000 pesos. So allergy testing po is also covered up to 2,500 pesos po. And speech therapy for stroke patients po, it is covered up to 10,000 pesos per member per year po via reimbursement po tayo. Okay? So the available process for speech therapy for stroke patients po or via reimbursement up to 10,000 pesos po at maximum. Then, initial treatment for animal bites. So basically, this one po, it is part of the exclusion, but we already waived this exclusion because it is now covered under our program. It is covered po up to maximum benefit limit. Okay, so the initial treatment for animal bites, that will be for the anti-rabies, anti-venom. So again, so covered up to maximum benefit limit po except for the cost of vaccines. Again, the initial treatment po is covered. Okay. So sir, how can we avail outpatient care? So for you to avail outpatient care, again, for branches for Valenzuela and Antipolo, first you must proceed to FUMC po. Or for the branches naman outside Valenzuela, Antipolo, like for Nueva Ecija, Pampanga, QC, and Laguna po, the availment process is that please go to the nearest accredited clinic with Coca Life. So everyone, I will be discussing two types of availment. First, availment before the pandemic, and second po, availment during this pandemic po. Because again, I believe sooner or later po, coronavirus will end and we're going to go back with our normal lives. So might as well allow me to discuss how can we avail in outpatient care, inpatient care, and emergency care po during this pandemic po and before the pandemic hits us. Okay? So I will be discussing first the availment process before the pandemic. So for members located or for the members po which are they are working in the Valenzuela and Antipolo campus po, first you must go to the FEMC po, or outside naman outside Valenzuela and Antipolo, the member must proceed to the nearest Coca-Cola Healthcare accredited clinic po. Then look for our plan coordinators. By the way, our plan coordinators po, they are doctors specialized in family medicine, internal medicine po, or they also have different specialization. Since they are doctors po, the first thing they will do to our members po is that they will conduct consultation. Okay, so say for example, sir, after consultation, plan coordinator po finds out that I do have daw a lung problem. Then I need the pulmonologist to check my lung problem further. So our plan coordinator po can give you a COCOLEF Healthcare accredited pulmonologist po. They will give you a referral to that certain specialist po that you are looking for para po makapag-proceed tayo with our medical treatment po. Or if we're lucky enough that the specialist po that we are looking for is the plan coordinator itself, they can now proceed with the treatment po. Of course, yung ati rin pong mga kakailanganin pa. Okay? So again, the first process is that before the pandemic, proceed to the FEMC po or any accredited clinic po, then look for our plan coordinators. So our plan coordinators po are COCOLEF Healthcare's partner doctors that we gave them po an authority to release letter of authorization, okay, to give po diagnostic request form and to also provide referral forms to any COCOLIFE member that they are looking for a COCOLIFE accredited doctor po. Okay? Everyone, so again, directly proceed to our COCOLIFE plan coordinator. So they serve po as our gatekeepers. So they help, guide, and monitor our members po during availment of outpatient care and inpatient care. But again, since we are under a pandemic po, we'll be having a different approach to avail this outpatient care. So sir, how can we avail po ba outpatient care? So for you to avail outpatient care po, the first thing we need to do po is set an appointment. Why? Because most of the doctors po are by appointment only. They are only allowed po to see a limited number of patients po. And they do have a clinic modified schedule. So please respect their time and arrive 15 to 30 minutes po before your schedule. If the member was able to secure consultation, the hospital or the clinic po will call COCOLIFE Healthcare for approval. So the first thing po that we need to do po is secure an appointment with the doctors, hospital po, and clinics po by calling them. Okay? For members po, for members under Valenzuela and Antipolo po, first we need to call FUMC po and ask for a doctor's appointment. Okay? We need to ask po for a doctor's appointment po. Then, for members naman outside Valenzuela and Antipolo, for example, members who's for the Quezon City part, okay, for the Quezon City campus, for Laguna campus po, Nueva Ecija, and Pampanga. So the first thing po that we need to do is that we must call the COCOLIFE Healthcare accredited clinic po and ask for the doctor's approval for your consultation po. Okay? So we need to set an appointment po. We need to schedule an appointment with your preferred clinics po or FUMC po. Okay? So that will be the first process. The second process, always make follow-ups po with the doctors and confirm your appointment and procedure. Okay? So the member has the responsibility po to make and follow up the appointment with the doctors po and their medical procedure. If you're having a trouble setting up the appointment or if you're having a trouble po, let's say for example, sir, I can't call this particular clinic po. Okay? Or I can't call sir this particular doctor. So if that happens to the member po, then our staff can give you an assistance. Why? They can provide you a different list of accredited clinics po, as well as the doctors and their contact numbers po for the member to have a different options. Okay? For you to have an options po. But please do take note that they are not responsible for setting up the appointment. It is the member's own responsibility pa rin to check and follow up the appointments po by calling the doctors if your schedule po is still in. Because we have this case po kasi, we have several cases that the only doctor present in this hospital po is the doctor kung saan si member meron po siyang appointment. Suddenly, there's this emergency case. Okay, there's this emergency case. Of course, the doctor po will treat the members who needs an immediate treatment. And the doctor po forgot that he has an appointment po with a certain patient. Of course po, pagpunta ng member po, the doctor is no longer in because the doctor po is treating a member inside the emergency room. So for you not to waste your trip po going to the hospital or clinic po, always check your doctor if your doctor is still in po, if they are still in po and they can proceed with the treatment of your consultation po. Okay? So always make follow-ups with the doctors po. Then verify the schedule po, okay? So if you're going out po, please be wise enough. So do not go to the hospital and clinic po without checking your prior appointment po. So after that, arrive at the center at least 1 to 2 hours prior to claim your letter of authorization. Okay? You can claim your letter of authorization po in the industrial
Opo.
section or HMO section po or the doctor or the plan coordinator po kung saan tayo nagpa-schedule of our appointments po. Okay? So this will be the new process of availment of outpatient care during this new normal. So as you can see po, we are practicing social distancing, okay? And we are avoiding mass gathering. So what we did po is that before you can avail with the medical treatment po, you must have an appointment first. Unlike before, you can proceed directly and conduct a face-to-face consultation. But for now po, again, we must have an appointment before we can before we can proceed with the availment of our consultation po. Okay? So, next benefit po is inpatient care. So, so what is inpatient care? Yan po ba yung nasa loob ng hospital? No, it's not. Basically, yes, it is. But again, so inpatient care po, this pertains to confinement. So basically po, that includes consultations, laboratory exams, diagnostic procedures, first aid treatment for accidental injury. Okay, so first aid treatment for accidental injuries po. Okay, so as you can see, the benefit for inpatient care is almost the same with in outpatient care. So general nursing services po, confinement, transfusion of blood, laboratory exams, standard admission kit. So the only difference is that for outpatient care, we discussed earlier po, prescribed medicines po are not part of outpatient care, right? But for inpatient care, medicines po are now covered throughout the confinement. Okay, so everyone, even though we are covering medicines, we still have limitations because multivitamins, supplements po, and probiotics are still excluded. We only cover immediate medicines po for members confinement, okay, or for the immediate treatment po of members illness. So okay, even though we are covering medicines po, we still have limitations because multivitamins, supplements po, and probiotics are still excluded po. We only cover immediate medicines po for members confinement. So for example po niyan, anesthesia for operations, oxygen tanks po, dextrose, antibiotics, pain relievers. Okay, so those are the examples of medicines po that we can cover. So the usual scenario for inpatient care with regards to the medicine. What if, for example, sir, during the time of my confinement, the doctor said that there is no available medicine po inside the pharmacy. Then, he asked me to purchase several medicine pots in the pharmacy because again, walang available sir inside the hospital's pharmacy. So if that happens to you po, you can purchase those medicines po and have it reimbursed with Cocolef Healthcare. And Cocolef Healthcare po will reimburse 100% actual cost of those medicines. Provided po that first, your diagnosis must be covered. Second po, you must have a remaining limit with your card. And for the last one, the member must submit a proof coming from the hospital that there is no available medicine po during the time of your confinement. Then we can allow reimbursement po. So later on, I do have a separate slide for you how to file for reimbursement. So not only for the medicine reimbursement, but for example, confinement reimbursement, availment for consultation reimbursement, as well as the requirements needed po. And of course, how can we file for reimbursement? But before I discuss that part, allow me to present how can we avail inpatient care. Okay? So everyone, just like outpatient care, I will be discussing two types also of availment during this for inpatient care. One is for during this pandemic and one before coronavirus hits us po. Okay, so first I will be discussing po before the pandemic. So before the pandemic po, before we can avail our confinement, basically confinement po, it will be directed to the hospital. Why? Because some of the clinics po, very few are covering inpatient admission. Okay, so basically, if we said admission po, it is redirected to the hospital itself. Okay, so before we can avail our inpatient care, before the pandemic po, you must have an admitting order. Of course, you need to go to the nearest Life Healthcare accredited hospital. But again, for members who are working with campuses in Valenzuela and Antipolo po, you must go to FUMC po. Okay, so we must go to Fatima University Medical Center. That is your first choice. Your first choice po is Fatima University Medical Center po. Okay, so again, the first process is that you need to go to the hospital, you must have an admitting order. So sir, where can we ask po ba? Or where can we find an admitting order? You can ask or you can find po an admitting order into a Life accredited doctor. If you already have that admitting order po, please present that to the admitting section with your Life health card to swipe and verify that you're a Life active member. So after verification, okay, everyone, for those members po who are not in muted state, so I at least ask po to please mute your mic if we are not going to ask questions because we might interrupt the others who's listening po. Okay? So apologies po for the calling of the attention, but again, it's for the sake of the orientation. Okay, everyone, going back with the presentation. So again, if you already have that admitting order, please present that to the admitting section along with your CocoLife health card for them to swipe and verify that you're a CocoLife active member. So after verification, your next process is that you need to select your room and board. So please select po your room and board according to your benefit. For example, your room and board benefit po is a regular private room category. So please select regular private room. Why? Because we don't want anybody po to incur incremental and excess charges. So again, everyone, if you're not familiar po with incremental and excess charges, allow me to discuss what is an incremental and an excess charges po. Incremental po and excess charges are applicable if you voluntarily upgraded your room beyond your benefit. So see, for example, your hospital, your room and board category po is regular, but you don't want to stay into a regular private room. You want a much bigger room. So from regular po, you voluntarily upgraded your room into a large private. Okay, sir, can we do that po ba? So pwede ba namin gawin yun? Yes, you can. But even though you can do that po, we are not advising, we are not encouraging our valued members. Why? Because incremental and excess charges po will kick in. Let's say, for example, there's an incremental or there's an excess of 1,000 pesos. Again, this 1,000 pesos po is just an example. It could go higher than 1,000 or it could go lower than 1,000 po, depending on the price of the hospital. So say again, for example, there's a room excess of 1,000. Then you're being confined for 3 days. So that 1,000 pesos po will also be multiplied by 3 times or it will also be multiplied depending on the duration of your stay. So if you're being confined for 5 days po, it will of course be multiplied by 5 times. Okay? So again, everyone po, so please select your room and board according to your benefit because not only for the room and board excess you will pay, but for the doctor's fee, laboratory exam, diagnostic procedure, or any excess po, it will be shouldered by our valued members po. So for you not to pay for that incremental and excess charges po, so please select your room and board category po according to the benefit. Okay? So after that, the hospital will notify Coco Life for the next 24 hours po, and we will issue po letter of authorization, and we will assist the members po if you need an immediate assistance with Coco Life Healthcare. And after that, after the treatment, after the confinement po, here comes PhilHealth. So I believe po, we are all members of PhilHealth. Okay, everyone? So please file for PhilHealth po on or before discharge, because we don't want anybody po from Our Lady of Fatima University paying for PhilHealth out of their own pocket. So sir, why do we need to file for PhilHealth before discharge? Okay, the reason is that po, Coco Life and PhilHealth po is two different entities po. Coco Life is a private company, PhilHealth po is a government agency. So Coco Life Healthcare po will not shoulder PhilHealth portion. So say for example po, your hospital bill let's say is 100,000 pesos, then the PhilHealth portion po let's say 40,000 pesos, the remaining 60,000 pesos po will only be deducted to your maximum benefit limit. What if, for example, sir, I forgot to file PhilHealth? Okay, nakalimutan ko, sir. So if you forgot to file PhilHealth po, Coco Life Healthcare, we will still cover our part. But the sad portion po is that the portion of PhilHealth po will be shouldered by the member. And that portion po, sometimes PhilHealth is no longer allowing reimbursement. The reimbursement for PhilHealth po is a case-to-case basis. So if they do allow reimbursement po, it would take several months. The worst case scenario po that I've heard is that PhilHealth reimbursement po, the member took at least 1 year for him to receive the PhilHealth reimbursement po niya. Okay, amounting to 10,000 pesos. So for you not to wait for at least months or year po, and for you not to pay for PhilHealth out of your own pocket po, so everyone please po, file PhilHealth on or before discharge po. And we all know, as of this moment po, PhilHealth is facing several problems, facing po several controversies po and issues. So for us to maximize our benefit, not only for Coco Life, but the government provided benefit po, because we are paying for this PhilHealth po. So the PhilHealth po is deducting a small amount of a contribution on a monthly basis with the members po. Okay? So for you to also enjoy PhilHealth po, so please file for PhilHealth on or before discharge natin. Okay? So that is the availment process before the pandemic. But since we are under a pandemic po, we'll be having only a different little approach. So we just made
Vic,
a... Yes, ma'am.
Vic.
Yes, ma'am.
Hi,
Just
Vic.
go.
This is Ara. Oo. Can you please medyo daw nabibilisan sila?
Ay, okay po. Sige po.
Thank you. Oo.
Okay. So again, everyone, going back
This is
with the
their
present...
first time to have a coverage. So make it slow lang. Thank you.
Ay, okay pa. So again, going back everyone with our inpatient care availment process during this new normal. So the first thing that we need to do is that just like outpatient care po, we need to call the hospital and ask for an approval. We only have a different approach. Okay, we just made a little bit changes when it comes to availment of inpatient care compared to new normal in this pandemic po and before the pandemic. Okay, so the hospital po, okay, the member must call the hospital first and ask for a preferred facility or a preferred doctor po and set an appointment. Okay, just like outpatient care, we need to set an appointment with our hospital po. Okay, so these also po include sending them the copy of the doctor's admitting order, the doctor's diagnostic request forms, and of course your health card membership details. Why? Because the hospital po will call Coco Life Healthcare and ask for the confirmation of your coverages po, and of course they will ask for the approval. So okay, once approved po, they can now proceed with the availment, of course, as scheduled po and as advised by our doctors. So as advised pa rin po tayo by our doctors and as scheduled pa rin po natin. So please be wise enough if you're going out, do not go to the hospital and proceed with your admission po without checking the doctor's prior appointment po. So by the way, everyone, after that, the member shall now proceed with the hospital po and choose a room according to the benefit po again to avoid avoid paying for the incremental and excess charges. As you can see po, the available process po is just the same. For inpatient care before the pandemic po, that will go into this that we need to go to the hospital, present our doctor's admitting order, then the hospital po will call Coca-Cola Healthcare for approval po, and we need to wait for the approval before we can now proceed po with the admission. We skip that part of you waiting for the hospital po for several minutes po or hour just to wait for the approval. For now po kasi, before we must go to the hospital po, our admission po must be already approved. Para pagpunta po natin doon, we can now directly proceed with the availment of our admission po. So what we're going to do is that we need to proceed with the hospital po and proceed with the admission. So that is the new normal availment process. We need to call the hospital po, set an appointment, then provide the list of requirements needed po, such as for example, the doctor's admitting order, then the doctor's diagnostic request form, and your health card membership details. Okay? So that the hospital po can call Coca-Cola Healthcare and ask for your confirmation of the coverage po and ask for approval po natin. We just skip the part of you waiting for the hospital po and waiting for Coca-Cola Healthcare's approval. Because usually po, that is the part that most of the hospitals po are having trouble. Okay, calling Coca-Cola Healthcare because some of them, for example, on the first try, they can't reach Coca-Cola Healthcare. What they're going to do is that they will put the member's application to the bottom part. Actually po, this is a personal experience. So I am inside this hospital po. Then it is just a consultation. On the first try, this hospital po can't reach Coca-Cola Healthcare. What they did po is that they put my application po in the bottom part. Then I need to wait again for my application to come to the upper part po. So what I did is that I called Coca-Cola Healthcare po and asked them, I am this hospital po, then please assist me with my consultation and my laboratory exam. So if that happens to you, you can always call Coca-Cola Healthcare. Again, I can share this presentation material po with the HR of Our Lady of Fatima University. And of course po, you will be having a card. Inside that card, at the back part of that card po, you can find our numbers naman po. Okay? So again, if you're having a trouble po with the hospital, they are not assisting you and you're with the hospital for several hours, everyone, you can call Coca-Cola Healthcare or might as well. Say for example, you're going to the hospital po or the clinic po. Okay, for example, you're going to the hospital or clinic. You can advise us ahead of time. So that is one tip that I can give to you po. That's one advice. You can advise Coca-Cola Healthcare po ahead of time. So please indicate your name, the name of your location. For example, you're going to this hospital inside Quezon City po. Then, or for example, saang hospital man po tayo. And of course, please indicate that you are a member of Our Lady of Fatima University po. So that we can call the hospital po or the clinic po and advise them that there's a COCOLEF member going to this hospital po and clinic po to avail their benefit po. Okay? So, emergency care. So sir, what is an emergency case? Emergency case po is a life and death threatening situation. It's a matter of life and death po and it can cause you permanent, partial, or serious disabilities po. Okay? So life and death threatening situation po tayo. So as you can see po, the benefit for emergency care is almost the same with in and outpatient care. Okay? Because emergency care po can lead to two types of availment. First, emergency leading to confinement, so that's inpatient care. Second po, emergency leading to consultation, so that is outpatient care. So again, everyone, the benefit is almost the same. The big difference only is that, as we discussed for inpatient care, what if, for example, sir, there's no available, let's say, regular private room entitled for me. So there's no available regular private room. In my case po, sir, is an emergency. Please do take note po, it is an emergency. It is not a scheduled admission. Hindi po kasi nakapagpa-schedule. Emergency po that will lead to confinement. So if that happens to anybody po and there's no available regular private room, we can occupy po the next higher room, which is large private po for the next 48 hours except suite room. And Coca-Cola Healthcare po will waive any incremental and excess charges po. So wala po tayong babayaran incremental and excess charges. you will be charged po according to your room and board entitlement po. Okay? So we have 48 hours of room upgrade po so that we can have an ample time to reserve our regular private room category, because after 48 hours po, we can go back to our regular private category po. Okay? So we after 48 hours po, we need to go back to our room and board entitlement po. So if you're asking, what if for example, sir, there's no available regular private after 48 hours? So we have options. The first option po is that if you want to stay with the upgraded room po, that's okay. It's just that po, we need to pay for the incremental and excess charges. But if you don't want to pay for the incremental po and the excess charges po, we have the second option. The second option po is that we can downgrade our room and board entitlement. For example po, we can downgrade it to up to, let's say, semi-private room or ward room po. And in that way po, we can maximize the availment of our card, because again, it will be charged po according to the benefit. For example, if you're inside a semi-private room, the availment po niyan, again, all of the charges po will be based into a semi-private room. In that way po, we can maximize our room and board entitlement po. We can maximize our maximum benefit limit po. Or for the last option, what if for example, sir, upon arriving po with us at the hospital, there's no available wardroom. There's no available semi-private. There's no available regular private. There's no available large private. In short po, there's no available any room. Worst case scenario, let's say. So if that happens to the member po, we have an ambulance service. Okay? So our ambulance service po, you can use this ambulance service and transfer to the nearest hospital, and the ambulance service po can be reimbursed up to 2,500 pesos po per conduction. Okay, just secure an official receipt or any adding supporting documents po that we used an ambulance service. Again guys, for the worst case scenario, there's no available any rooms po, so you can use po an ambulance service po and transfer to the nearest hospital for immediate treatment po natin. And of course po, the ambulance service po can be reimbursed up to 2,500 pesos po, that is per conduction po natin. Okay? So, sir, how can we avail emergency care? So, emergency care po, if your case po is an emergency, again, it's a life and death threatening situation. It's a matter of life and death po, and it can cause us permanent or partial disabilities po. So, if your case po is an emergency, directly proceed po with the ER of the hospital so that the hospital po can establish treatment. If you forgot to bring your card po is missing, you couldn't find your card po, that's okay. Just declare that you're a CocoLife card member so that the hospital po can call CocoLife Healthcare po and they can ask for approval and assistance with CocoLife Healthcare. Again everyone, if case po non-availability of CocoLife Health Card, please declare lang po that you're a CocoLife card holder. So everyone, a little information, okay? Emergency room po is not a first come first serve basis. Why? Because they have this triaging system, in which in case po the hospital po or the hospital po, they have this triage inside the emergency room. The nurses and the doctor po present po in that triage po will rule out every patient case from non-urgent, urgent to emergent. So by the way, of course, non-urgent po, not life-threatening condition. Emergent po is the critical cases po natin. Okay? So emergent po is the critical cases. That will be for the life and death medical condition po. So the usual process of triaging po, they will ask you on how you're feeling. For example po, on a scale of 1 to 10, what is the level of your pain? For example, if you said 10, of course po, it will fall for emergent case po. So they will ask several questions po to rule out your level of emergenciness po. Okay, everyone? Emergency room po is at a first come, first serve basis. They have this triaging system po that each and every hospital po is following po nila. Okay? So this is the availment process po if you're being brought into a CocoLife Healthcare accredited hospital. But what if, for example, sir, we are being brought into a COCOLEF Healthcare non-accredited hospital. Nadala po kami, sir, sa hindi accredited na COCOLEF clinic or hospital because the usual case or the usual mindset of a person po during emergency cases that bring the patient to the nearest hospital for immediate treatment. So if that happens to you po, we can allow reimbursement. So COCOLEF Healthcare po will reimburse 100% po, okay, up to 30,000 pesos per confinement po based on standard dates. So everyone, it is not automatically 100% of what we've paid, but 100% po of the standard rates of all HMO provider. So allow me to discuss to elaborate this part po. Okay. If you're a private paying patient, usually we are paying the doctor from 500 pesos for his professional fee per consultation. But if you're a member of any HMO, for example, COCOLEF member or any HMO provider member po, all HMO providers po, we are following the same rates po. Okay? So we did not make these rates, but the Association po of the Philippine Doctors po and the Insurance Commission po, and of course po, AMOFI. Okay? So sila po yung gumawa po ng rates na yan, not the HMO providers. So the usual rates po for the HMO providers po, so it's from 300 to 350 per consultation. So the amount that we can reimburse po is that 100% po of that 300 or 350 po, that is per consultation po natin. Okay? So this will be our reimbursable amount. 100% of HMO rates po up to 30,000 pesos per confinement. The reimbursement requirements are, first, we need to send po a medical certificate with a final diagnosis for us to check po if your diagnosis is coverable or not. Second po, official receipts and a statement of accounts. So a statement of accounts po tayo. So okay, statement of accounts po. Then, for the statement of account po, it must be an itemized one. So, it must be an itemized one po. So, okay. So, it must be po an itemized one. We need to see po the breakdown of expenses. So, kailangan po natin ng breakdown of expenses po. Then, nakondawad po for accident cases, so police and or incident report. Pag aksidente po yung case po natin, kailangan po natin mag-set ng police and or incident report. Sa turnaround time, meron po tayong 30 calendar days to file for reimbursement. So 30 calendar days po siya after natin ma-discharge. So we have 30 calendar days after the date of discharge po to file for the reimbursement. Then for the processing time naman po, si COCOLEF Healthcare, meron po tayong 15 working days. Okay? Meron po tayong 15 working days para po for our part to process po yung inyong reimbursement claims. The reimbursement flow po is that, ang gagawin po natin dito, all of your reimbursement claims po, please send it with our HR. Kasi po si HR po, ibibigay po siya kina Howden, kina Miss Ara po, for Miss Ara po to initially evaluate your claim. So na Miss Ara po, ang gagawin po nila, they will initially evaluate your claim. So they will check your claim po if your claims po or the documents are complete, kung kompleto po ba yan, lahat po ba original po, para po kung may kulang or may missing po, they can inform you po before sending it to COCOLEF Healthcare. Okay? So this will be our availment process of reimbursement po. The reimbursement flow, lahat po ng documents po natin, please provide it with the HR because the HR po will send it to Howden po para si Howden mabigay po siya kay COCOLEF po. Para po kami, ma-process po natin within 15 working days. And ang reimbursement po natin po, check po siya. It's a form of check po siya. Of course po, for security purposes din po siya. Okay po. Then, financial assistance. So, COCOLEF Healthcare po is a division of COCOLIFE. Kami po ay division po ni COCOLIFE, which is a life insurance po registered company. So, automatically po, meron po kaming financial assistance amounting to 10,000 pesos pag ang death is due to natural cause. Pag ang death naman po is due to accident po, that is 20,000 pesos po. Okay? So, that is 20,000 pesos for death is due to accident po. Pero again, everyone, wag naman po sana tayo mag-a-avail po nito. Our life po is more valuable than any other amount po. Ang ating pong buhay ay wala pong tutumbas na kahit anong manghalian. Okay po? So, special procedures po with sublimitation. Ito na po yung mga special procedures po natin na may mga sublimits po. So, kanina po covered natin yung animal bites, initial treatment. But for the vaccines na po, covered na natin siya up to 40,000 pesos. So, animal vaccines po, like for example, anti-venom, anti-tetanus po, vaccines po, so cover natin siya. Anti-rabies, vaccines for those examples. Covered po siya up to 40,000 po. Yan ay shared limit. Congenital conditions po and congenital hernia, yan din po ay part na exclusion pero covered na natin siya. For congenital conditions, yan ay 20,000 pesos. For congenital hernia po, that's up to maximum benefit limit po. For 4S, yan pong 4S na tinatawag natin, yan po yung sa back or spinal problems. For example, slip disc, okay? Scoliosis, spondylosis po, and spinal stenosis, covered natin siya up to 40,000 pesos. Okay? Then for laser treatment po, covered din siya up to maximum benefit limit po. Ang ating pong laser treatment po, yan ay covered natin para po sa glaucoma and retinal detachment po. Pero yung mga error of refraction, for example, sir, malabo yung mata ko, ipapalaser ko po siya, for example, LASIK or PRK, para po luminaw ulit siya. Yun po
Valenzuela
yung
pala si Gold
hindi
Chancellor.
po yun yung cover
Si
natin.
Pipoy po
Okay?
yung QC.
Ang covered po natin dito are for glaucoma and retinal detachment po. Then, cataract extraction po except yung cost of lens up to maximum benefit limit din. Then, work-related conditions po or accidents, covered na natin siya up to maximum benefit limits po. Okay? Yan po yung other conditions po natin with specific limitations po. So, next po natin is the special provision. Ano po yan? Yan po yung ating pre-existing medical condition. Sir, ano po yung pre-existing? Ang pre-existing po, yan yung mga sakit natin dati. Kahit alam po natin or hindi natin alam na meron na po tayo yan bago pa tayo maging COCOLEF member, covered na po natin siya. For example po, si member po ay, let's say, may asthma. Okay? Si member sa may asthma, si member sa diabetic, meron po siyang benign or malignant growth, cardiovascular or kidney diseases, hypertension po, history of stroke, wag naman po sana, cancers, tumors po, ulcers, gastroenteritis, yung mga nabanggit ko po, they are all pre-existing. So again, these are your illnesses before, whether you knew it po or you don't know it, that you already have these illnesses po, bago pa kayo maging member ni Coco Life, covered na po namin yan. Okay? So covered po siya up to maximum benefit limit po for employees. But for the average members, 65 and above po, if there's any, maka-cover natin siya up to 50% of your maximum benefit limit po. Okay? So, policy exclusions. Ito na po yung mga items na hindi natin covered. So, okay po, this will be the last part of our discussion po. The items that are not covered po for our exclusions. Okay? For our benefits po. So again everyone, I already deleted several exclusion. Nagtanggal na po kami dito kasi po covered na natin siya. So again, so let's discuss exclusions po. Exclusion number 1, yan po yung self-inflicted. Sinaktan po ninyo yung sarili po ninyo. Sinaktan ninyo voluntary. Example, inuntog po ninyo sarili niyo sa pader, nag-commit po kayo ng suicide, knock on the wood po, whether successful, non-successful, hindi po siya covered, okay? Or nag-self-destruct po kayo, okay? Nag-attempt po kayo magpakamatay or sinaktan po sa inyo sarili ninyo, they are all parts of exclusion number 1. Number 2, yan po yung kapabayaan po ni member. Example po si member po, sir, lasing, nagmanehot na aksidente, exclusion number 2 po natin yan. Or, nag-violate po kayo ng government law at ordinance, example po niyan, beating the red light, simple jaywalking po, no U-turn, nag-U-turn po tayo, na-aksidente po si member. One way, nag-counterflow po si member, lahat po yan ay part ng exclusion number 2 po natin. Okay, basta po members on misconduct. Example naman po niyan for pedestrian po, jaywalking. Okay? For number 3, yan po yung participate po sa mga delikadong laro like aqualang diving, bungee jumping po, mountain climbing, rappelling plus skydiving. Any extreme sports po and activities. Okay? Especially po pa nag-sign tayo ng waiver. Kasi po yan po yung mga nabanggit natin, lahat po yan, lahat sila ay extreme or dangerous sports. So pag nag-participate po tayo dyan, then mangyari po sa ating masama po, automatically po it will be part of exclusion number 3. Okay? Number 4, kung kayo po sumasali po sa rally, sa gera po, sa strike, sa mutiny. Okay, lahat po yung part of exclusion number 4. So sa rally naman po, whether direct or indirect participation, direct participation po, for example, nandun po kayo, then may nangyari pong masama kasi po nasa rally kayo, nag-participate kayo, exclusion number 4 po yan. Indirect participation naman. Sir, si member, wala naman po siya doon. Sa kasamaang palad po, siya po yung nagpasimula ng rally. So exclusion number 4 din po yun. Sir, paano naman? Pauwi po si member. Okay, the member sir is just passing by. The member is on his way home. Ang nangyari po, yung rally po sir, naging riot. Pero sir, napadaan lang po si member. Then, nasugatan po siya, may bumoto po sa kanya na kung ano, nadamay po siya, covered po yun. It will be covered as long as po you're just completely passing by. Dapat po, wala po talaga tayo sa rally na po na yan. Okay? Number 5 naman, kung kayo po naka-reserve sa Army ng Philippines, exclusion number 5 po yan. Like for example, si member po sir, Reserve Navy, Reserve Army, Reserve Government Cadets po, okay? So Reserve Marines, so Reserve Air Force, sa lahat po yan ay exclusion number 5 po natin. Or for example naman sir, si member po ay government elect barangay official. Then ginagawa niya kanyang duty. Since po ang Metro Manila nasa community quarantine pa rin, then ang lahat po ng cities po ay sila po ay nag-implement po ng curfew. For example, si member po government elect, barangay captain, barangay kagawad po, barangay tanod. Then sa gabi po sir, si member po Oromoranda or nagpapatrol. Sir, sa pagronda niya po, sa member na sugatan or siya po ay nagkaroon po ng any injury po. So lahat po yan ay dahil sa kanyang pagpapatrol, so lahat po yan ay part ng exclusion number 5 po natin. Okay? For number 6 naman po, yan po ay si member, for example, sir, nagpa-participate po or mahilig si sir makipaghamon ng away. Okay? Makipaghamon po ng away. Makipaghamon po ng suntukan. Magpasimula po ng bugbugan. Ang masama na nga po niya, sir, si member na po naghamon, siya po yung nabugbog. Okay. So everyone po, basta po kayo po yung naghamon, again from the root word provocation, kayo po yung
Hello?
Hello? Na-stop po ba yung presentation?
Hello? Hello?
Hi, we
Yes,
can hear you. We
we
can
also
hear you,
lost.
Sir V.
We lost him, I think.
I see. Sige po. I-share ko po yung screen. Si Cherry po ito. I'll continue po sa presentation with dun sa last presentation ni Sir Vic. Can you see my screen?
Yes, we can.
Tama
Thank
po
you,
ba
Cherry.
Tama po ba yung last presentation ni Sir Vic? Nasa number 6. Alright. So,
Yes, that one.
alright po. So, for the number 6,
Yes, that one.
Apo. For the number 6, exclusion. So, ito po yung murder
Cherry,
and
can you please
Full screen na lang.
Cherry, hello?
Yes po, Miss Ara.
Can you
Miss
switch
Ara?
on to that full screen?
Cherry,
Thank you.
oo.
Apo.
Can you please widen your screen na lang? Thank you.
Apo. Okay na po ba?
Yes,
Yes,
it's okay now.
Paki-widen
It's
mo na lang
okay.
yung screen
It's
mo,
already
dear.
wide.
Thank you.
Alright po. Ayan, so for the number 6, so ito po yung murder and
Cherry.
assault. Po, Miss Ara.
I think it's okay now. It's already wide.
Alright
You
po.
may proceed po, Ms. Sherry. Thank you.
Alright po. Thank you. So for the murder and assault, homicide or any attempt, so for example po, meron po tayo mga members na sila po talaga yung nag-provoke. So basically po, hindi din po siya maka-cover ni Coco Life Healthcare. So given po na meron po tayong police report, incident report, basically from number 1 to 6, Coco Life would be needing a copy of incident report, police report for us to evaluate po yung mga cases ni members, kung makakover po ba namin siya or hindi. Um, and then for the number 7, so ito po yung mga mental or any psychological disorders or dysfunctional. So ito yung mga members natin na for example may problem po psychologically. So if ever po may mga attempt or mayroon po kayong ipa-consult psychologically, hindi po siya maka-cover ni Coco Life since part din po siya ng mga exclusions and conditions po natin. Ayan po. And then for the number 8, so ito yung mga members po natin na
Hello, Cherry.
Hello, sir. Yes, sir.
Okay. Everyone,
Yes, go ahead, Vic.
I do apologize, everyone. My internet connection was lost po.
Alright,
Okay.
go ahead, Sir Vic.
Cherry, may ask, saan ka na natapos po?
You can proceed now with the number 8,
Okay.
exclusions and conditions.
Okay. Again, everyone, I do apologize. My internet connection po was lost. Okay. Okay. Going back with exclusion number 8. Sa exclusion number 8 po natin, this will be for the members' voluntary confinements. Ano po yan? For example, sir, si member po, magpapakonfine po siya without doctor's recommendation or without doctor's admitting order. Or si member, sir, magpapagawa ng series of laboratory exam without doctor's admission. Okay, for example, pumunta si member sa isang hospital or clinic po, then siya po, sir, ay nag-request ng pagkadami-daming laboratory exam without a doctor's admission po, without a doctor's referral form. So exclusion number 8 po natin yan. So we call that po voluntary confinements po or voluntary availment of the benefits. Because again, ang golden rule po natin dito, you must have a diagnosis. Your diagnosis po must be coverable. And again, you must have a doctor's request form. And your doctor po dapat, yan ay Coco Life accredited doctor po natin. Okay? So for number 9, so yan po yung mga dental work. Example po niyan, pagpapalinis ng ipin, pagpapagawa po ng pasta, okay? Whether permanent or temporary pasta, pagpapagawa po ng pustiso, ng jackets po, paglilinis, okay, pagbubunot. So lahat po yan or pagpapacheck up po, exclusion number 9 po natin yan. So any dental work po are part of exclusion number 9. Dito rin po papasok yung beautification po in nature. Beautification po in nature in a way na si member po nagpapagawa ng mga ganitong procedure na hindi siya medically necessary. Ano po yung mga examples niyan? Let's say liposuction. Okay, liposuction is number 1. Augmentation, facelift, nose lift plus plastic surgeries po. Any treatment po siya, okay, na hindi po siya medically necessary for beautification purposes lamang. Dapat po dito, medically necessary po dapat. So kailangan po siya for medical purposes po, not for beautification purposes po dapat. Okay? So, in procedure.
Vic, ako yung naka-share screen.
Oo nga pala. Sorry, Cherry. Okay. So, sige, Cherry, proceed ka na lang.
Wait. Ayan, go ahead.
Okay. For exclusion number 10, everyone, this will be for the illnesses like AIDS, HIVs, STDs po, procedures po like ligation, vasectomy po, lahat po yan ay exclusion number 10 po natin. Or any treatment po in relation to pregnancy or childbirth. Example po niyan, delivery itself. For example, after delivery, meron tayong postpartum. So lahat po yan are parts of exclusion number 10 po natin. Or any attempt of artificial insemination. Okay, sex transformation po. So they are all parts of exclusion number 10. For number 11 naman po, this will be for the PhilHealth portion. Again, everyone, for the last time po, we are advising you po, please i-file po natin si PhilHealth po bago po tayo ma-discharge kasi po hindi siya covered ni Coco Life. So this PhilHealth po is not covered by Coco Life, and para hindi tayo po magbayad ng PhilHealth out of our own pocket po, so please file for PhilHealth on or before discharge po natin because again, hindi po siya makakover ni Coco Life Healthcare. So everyone, may clause po tayo dito na medyo na applicable po talaga sa atin ngayon. Ang clause po dito is that treatment for any communicable disease declared by any government agency or entity po as causing a state of emergency po in an area. Ano po yan? So basically po, that is COVID-19. Just like any HMO, COVID-19 po is part of exclusion. But we from Coco-Life Healthcare, kinovered po namin yung COVID-19 for the sole purpose po of humanitarian reasons. Gusto po namin tulungan yung ating fellow Filipinos po, yung mga card holders po ni Coco-Life, kaya po kinovered natin yung COVID-19. So again, COVID-19 po is subject, is exclusion. So ang coverage mo natin ito, subject for Coco-Life parameters po and Coco Life daily review. Okay? But as of the moment po, covered natin siya. So sir, since we are talking about COVID-19, is there any chance po ba na covered ang swab-testing? Yes. Swab-testing po is covered basta po dapat kayo ay symptomatic. You must be po asymptomatic. Okay? Symptomatic po, not asymptomatic. You must have symptoms. You must be COVID suspect po, and you must have a doctor's recommendation, of course, coming from a Coco Life accredited doctor po tayo. Okay, everyone? Dapat po may symptoms po tayo dito. But for example, sir, kailangan ko, sir, magpagawa ng mga laboratory exam. My doctor requested me, sir, to have this swab testing po for the sole purpose of clearance. Para, sir, makapag-proceed ako, kailangan ko, sir, ng clearance. Naka po, sir, COVID negative. Yung po exclusion po natin yan. Okay, you must have dapat dito symptoms po and you must be COVID suspect po before bago natin makover yung swab testing po. Okay? So go ahead, Cherry, for exclusion number 12.
Alright.
Okay, for exclusion number 12 po, this will be for any extra equipment that you are fond of asking for of. For example po, sir, na-confine si member. Then maliban po sa standard admission kit, si member po, sir, he requested for an extra pillow, an extra blanket, extra bed, extra food. Sir, si member po nag-hire ng private doctor, private nurse para, sir, meron silang extra medical service po, hindi natin yung covered. So any extra equipment or any extra service po na hiningi natin during confinement po beyond the standard admission kit po, kay members on expense na po yan. Okay? For number 13 po, this will be for the metal equipments, orthopedic hardware, surgically implanted devices po, prosthetic appliances, like for example po yung crutches, fiberglasses, wheelchairs, so lahat po yung exclusion number 13. So another example po, sir, si member na aksidente, sa kasamang palad po, nabarian siya ng elbow, ng hip, okay? Ng knee, o yung mga ganun pong cases po natin. So lahat po yun parts ng mga broken body parts. Sabi ni doctor, para na ma-proceed yung kanyang treatment, kailangan ng metal equipment. So hindi natin covered po yung metal na gagamitin. Pero po yung pagkakabit ng metal, pagtatanggal po, the doctor's fee, laboratory exam, surgeon's fee, room and board, so lahat po yun, even to the medicine po, covered natin yon. Except lang po sa mga metals po na gagamitin pa natin. Okay? So lahat po yun yung ating exclusion number 13. So again, everyone, nag-delete na po tayo. We already deleted several exclusions kasi po yan ay covered na natin. So this sums up our exclusion po. So again, this will be for the last part of our exclusion po. Okay, Cherry, let's proceed po with the next slide. Okay.
Vic, pwede ikaw mag-share?
Okay.
Thank you.
So everyone, that basically po that is our exclusions. So we again we already deleted po several exclusions because it is part of our benefits na po. Again, I do apologize for me leaving the orientation po. My internet connection po, natanggal po siya. Okay. So important access points po, beside from our hotline numbers, we have our own website. You can also visit our website po, cocolefhealthcare.com.ph po. And again, flash on the screen po are our contact numbers. So everyone, in the event po, for example, you want to check kung saan po yung pinakamalapit na hospital po ni Coco Life or clinic po, our website po can provide you the details. So pwede po ninyo puntahan yung website po ni Coco Life. Updated po yun. On a monthly basis po, nag-update po kami ng aning networks of providers po doon sa website po ni Coco Life, which is cocolifehealthcare.com.ph po. Okay? So everyone, this will be the last part of our orientation. So I believe po we have several questions po in the Q&A. So I will address those questions po. So Miss Ara, nawala po yung aking pong connection. So some of the questions po are also lost. So yung mga pumasok pong questions po sa akin ngayon ay yung questions po nung pagbalik ko po with the orientation. So I believe ma'am or Miss Cherry po, you can assist me with reading the questions po and we'll try to answer po yung questions po nila. Okay?
Alright. By the way, Vic, those questions pala na nandito sa chat box na answer na din pala natin privately. Pin-answer ko na privately, but yung current question we have right now is from Mr. Romeo Sano. I think na-discuss mo na din about yung COVID-19 cases or COVID-19 procedures or coverage.
Yes po.
And
Apa.
then another question is yung number one question niya, if there's an option of the member can directly present the prescribed diagnosis workup procedures to any accredited health facility.
Okay. Sir, actually po sir, pwede po yun. It could be done. Okay, as long as po sir yung workups po ninyo is made by Cocolef doctor. And you will present it, sir, to a Cocolef Healthcare accredited facility din po dapat. Okay, sir, the golden rule must be, you have a diagnosis, your diagnosis must be coverable. Your yung mga request form po natin for the laboratory exams must be coming from a Cocolef doctor and ipe-present natin siya, sir, sa Cocolef Healthcare accredited facility po. Okay? For branches po, campuses ni Our Lady of Fatima University from Quezon City, okay? Quezon City po, Nueva Ecija, Pampanga, and Laguna po. Our first option po is to the clinic po tayo. Clinic po. For example, sir, ang pinakamalapit po na clinic po is hours away. Of course, next time po na pwede tayo sa hospital. But our first choice po must be a clinic. Another example, sir, pagpunta ko sa clinic po, sir, yung pininiscribe po ni doctor na diagnostic laboratory exam, wala po doon. Then, sir, pumunta ulit ako sa panibagong clinic, sir, wala ulit. So if that happens to anybody, wag naman po sana. We're just giving scenarios po. So pag ganun po yung nangyari sa atin, we can now proceed po to the hospital para gawin po yung ating laboratory exam. Okay? So clinics po tayo, our first option po for availment for outpatient care laboratory exams for Pampanga, Laguna, Nueva Ecija, and Quezon City. But for Antipolo and Valenzuela po, we must prioritize po Our Lady of Fatima University po. Okay?
Thanks, Vic. And then another question from Miss Mary Ann. For existing illness po for dependent, CA still available po ba? Currently po, Miss Mary Ann, wala lang po tayong coverage for dependent. Of course, we are open for enrollment naman po, but that will depend on your management's approval, hopefully for your renewal po next year.
Apa.
Ayan, so next thing.
Sir, another question po that
Go ahead, Mr. Raquel. Sige po.
there was a question, how about online consultation? Is it covered? Covered daw po ba ang online consultation, sir?
Cherry?
Hello, Vic. Yes, ma'am. For online consultation, currently wala lang po tayong online consultation. Yung procedures pa natin is magbe-base po sa standard procedures po ni Coco Life in availing the program. But if ever po kung meron kaming online consultations, mag-heads up naman din kami agad kay Team How din para po makapag-provide po kami ng services to your account.
Okay, we have several questions po at the chat box. Sige po, we'll try to answer this one po one by one.
Alright. So, again pala, Vic, i-clear ko lang yung na-mention ni Sir Vic kanina about sa general exclusions and conditions na include namin yung dental. For your account, wala lang po tayong coverage for dental and annual physical exam. So, yung represent kanina, standard lang po yun as general exclusions and conditions. So, just to clear lang po, wala po tayong coverage for the dental procedures.
Okay. We have a question with Miss Flor. The question of Miss Flor is that meron po siyang existing card with MaxiCare under his husband, under her husband. So ma'am, you can use two cards. You can use two cards, ma'am. So ang gagawin po natin is that for example lang ma'am, for your first availment, for example, Coco Life, meron tayong 5 days of confinement. Let's say for 5 days of confinement. For the first 3 days po, naubos na yung 110,000 natin with Coco Life. Ma'am, what will you do is that, please sign a discharge slip only on papers only. Para po yung first 3 days of confinement po ninyo will be charged to Coco Life. And another admitting papers po only, again on papers, para yung remaining days po natin kay MaxiCare na po. But again, ma'am, we have one hospital, Makati Medical Center po. They have this blanket authority, 1 HMO per member per availment po. But besides from Makati Med po, wala na po ko narinig na may hospital po nagpapatupad po ng blanket authority. Again, you can use two cards at the same time po. So, kailangan lang po ma-exhaust yung una bago po yung sunod ulit. Okay? Okay, we still have other questions. Fully covered po din ba yung ultrasound sa kidney kapag ginawa? Sir, covered natin yung ultrasound. But again, sir, we will be basing on the diagnosis. For example, sir, let's say, ang diagnosis po natin ay gallstones. Kailangan natin sa lithotripsy. Let's say, ultrasound or laser, sir, para matanggal yung mga stones po niyo or sa kidney, sir. Maka-cover natin sa po, sir. Okay, sir, basta po dapat, ang kailangan ay FEMC accredited Coco-Life doctor. And dapat po, sir, your diagnosis po is coverable din po dapat tayo. Okay? Okay, so we have another question. So, sir, lahat po ba ng clinics niyo may POS? So, what if kung wala, tawag na lang po ba sa clinics pwede na? That's correct po, sir. Sir, ang POS terminals po are not Coco-Life owned. Hindi rin po, sir, owned ng kahit ano, sir, na HMO provider. Nag-outsource po tayo. So, depende po, sir, sa clinic po kung sila po ay magpapakabit ng POS. That's correct, sir. Not all clinics, especially, sir, sa mga provinces, kaya sa additional expense pa po nila yan, so usually, sir, hindi po sila nagpapalagay ng POS terminal. So, if wala pong POS terminal po, sir, you can call po yung Coco-Life Healthcare numbers po para po kami mismo yung tumawag sa hospital po at ma-assist po sa member. Or so you can call us po na para po ma-assist po namin kayo. Okay pa? Okay. Again, for those members po who's asking for dependents po, as Miss Cherry mentioned earlier po, so as of the moment po, our program for Our Lady of Fatima University po, dependents coverage po is not yet covered for this policy year. For next policy year po, we can try to negotiate this. We can also try po na i-suggest siya with the upper management po para po ma-cover yung dependents po. But again, as of this policy year po, dependents coverage po is not yet part of our benefit po. Okay? And for those members po who are asking, sir, since po mag-i-start na yung coverage natin sa December 15, pwede na po ba namin magamit agad yun? Outright po, December 15? Yes, pwede na po yan. Basta po once po na-active na yung names po natin at nag-start na yung policy year, so pwede na po natin gamitin yung ating benefit coverage po kay Coco-Life Healthcare start November 15 po. Okay? So we have another question with Miss Annie Rose. So, yes po ma'am. So pwede rin po natin gamitin ma'am yung HMO. So actually ma'am, FEMC po yung ating pong first po. Pero for example, maano po natin, yung HMO card natin ma'am, pwede naman po natin siyang gamitin po. Okay? lahat po ba ng FUMC doctors COCOLIF accredited doctor? Ma'am, I don't know who sent this question po. But it will depend, ma'am or sir. Kasi po kahit kami gusto namin i-accredit yung mga doctors lahat sa hospital. But again po, kay doctors pa rin po, depende pa rin po yan. So rest assured naman po na yung mga doctors po natin doon, we have several doctors po with several specialization. For example po, may doctor tayong preferred, then let's say cardiologist po siya, pwede natin siya accredit, sir. Kaya po sir, kanina or ma'am, yung ating pong first slide na mention ko po, we can accredit these doctors. It's just that po, it will depend on those doctors po if they want to be accredited po ni COCOLIF Healthcare po. Okay? Sir, you must be a regular. According sir to our according to our eligibility of enrollment po, the member, before we can cover the member po must be a COCOLIF must be a regular full-time employee of the company po or of the university po. Okay? When do we get our card, ma'am? Teresa. So ang card po natin, ipapadala po siya ni COCOLIF Healthcare via courier po o na per branch po siya, per campus po tayo. Per campus po yung papapadala po natin dito. Okay? Okay. Miss Catherine, again, if your case po is an emergency case, pwede po tayo dumiretso po sa clinic po sa hospital. Pero pag scheduled consultation po sa or scheduled confinement po, for Valenzuela and Antipolo po, we must prioritize FEMC po. Okay? What if, for example, we did not use HMO card within the year? So first of all po, ma'am or sir, we must be happy because healthy po tayo. So, but hindi po natin pwedeng i-encash yung 110,000 ha. So, hindi po siya pwedeng maging cash po. Okay? So, yan po ay safeguard lang po if in case happens to us, then kailangan po natin ng medical assistance po. MRI po, Sir Victor po is covered. Ma-covered po natin yung ating pong MRI po. As long as po your diagnosis po is coverable. Yes, Ms. Marie po, that's correct po. Annual physical examination po is not part of our benefit limit po for this policy year po. But for example, ma'am, nasa consultation po tayo. Then yung doctor po nag-request ng series of laboratory exam para na rin po siya, for example, magiging annual physical examination. Pwede po yon as long as po na doctor's request po tayo. As long as sa doctor's request po siya. Okay. So we have a question from Maria Cristina Castro po. I am an employee of OLFU, Valenzuela, but living in QC. For example, emergency case, I went to a COCOLIF accredited hospital ER in QC and advised to be admitted. Will my admission po in QC will be covered or should I be transferred to FUMC for admission? Ma'am, if your case is transferable, you can transfer for FEMC po. Kasi again, we must prioritize po Fatima University Medical Center. But if your case po is non-transferable, again, life and death threatening condition po, you can avail po yung ating admission po in QC Hospital because this is an ER case. Again, pag ER case po tayo, pwede po tayo dumiretso po sa hospital or any clinic po accredited by COCOLIF. But again, if your case po is transferable, we can be transferred to FEMC because we must prioritize po the usage of FUMC po. Okay? Sir Romeo, sir, yung ating pong laboratory exams po kayo, sir, we have our own forms. Yung forms po natin, sir, galing kay COCOLIF Healthcare po ito. And binibigay po natin sa mga doctors. Sir, pwede siya maging printed as long as po, sir, yung prescription po ay COCOLIF accredited po yung kanyang form. Kaya, sir, we have our own form. Pero, sir, kung ang prescription pa ni doctor ay own prescription pa ni doctor, that CocoLife Healthcare referral forms po sir, dapat po sir CocoLife accredited po yung ating pong forms po. CocoLife owned po dapat yung ating forms po, not owned by the doctor. Pero sir kung CocoLife owned po yan, pwede sir maski printed po. Basta sir nandun sir yung mga details required po natin. Okay? What if I'm from Bulacan? Can I use the card to the nearest CocoLife HMO provider? Sir, again, for example, you are in Bulacan. Kaya so ang mini-mention po natin dito, sir, na Valenzuela and Antipolo, hindi po sir kung saan tayo nakatira. With, let's say for example, Valenzuela and Antipolo. You must be working with Fatima University po, already Fatima University, Valenzuela and Antipolo campuses. Yun po dapat. For example, sir, from Bulacan po tayo, but you're working with, let's say, Valenzuela campus po, you must use pa rin FUMC. Yun pa rin po, sir, yung ating kailangan i-prioritize. Pero again, sir, if that's ER case, pwede natin, sir, gamitin yung pinakamalapit na CocoLife Healthcare accredited clinic po or hospital po pag ER case po tayo. Pero kung schedule consultation po siya, schedule confinement po, again, we must prioritize the usage of Fatima University Medical Center po. Okay. Yes po, we have accredited hospitals po and clinics po in Bulacan. We have po yan. Our network po is around the country po. We have again 1,750 combined hospitals and clinics po nationwide and counting pa po tayo. Okay? So any more questions, everyone? None? Questions po going once? Okay. Miss Cherry, Miss Ara, do you have anything else po to add?
Hi Vic, this is Kitin from Howden.
Hi ma'am.
Hi. There are members kasi na asking for coverage for their dependents. So it is clear na for this policy, we only have employees for the benefits. If in case there are principal members na would ask for a proposal for individual, meron po ba tayong ma-offer or paano po ba natin sila ma-assist? Kasi if I may advise, we can wait for next policy year for the renewal. Baka ma-negotiate natin na principal plus dependents. However, there are employees nga na they would want to have a policy din for their dependents. Meron po ba tayong available proposal for individuals?
Hello Cherry, I think you can answer
yes.
that one po.
Thank you, Ms. Kitin. For your query po, with regards to the individual policy, currently po si CocoLife, wala pa po kami individual HMO policy. So tama po yun na-mention ni Ms. Kitin, our option would be if willing po yung management po ninyo, we can have your dependents enrolled upon renewal po or for the next renewal, we can negotiate naman po with your management if willing po sila or depende din po sa internal arrangement po ng company po ninyo. But again, open po si CocoLife for enrollment po with your dependents, but wala lang po kaming individual policy at the moment.
Apa. The reason po we are not giving individual policy is that kasi po pag company siya, the premium is much lower. And yung pre-existing po, pag individual po siya, usually po the first 1 year or 2 years po, hindi siya covered. So ayaw naman po namin mangyari na si member, let's say nagbayad ng premium on the first year, then kailangan ng pre-existing na treatment, hindi siya ma-covered. Usually po, that's the usual dilemma of HMO providers po na may mga individual plan. So ayaw naman po natin mangyari na si member magbayad ng premium, then hindi siya ma-covered on the first year or let's say first, second year na kanyang coverage po. Okay? So we have another question po. Apo. Thank you, ma'am. So, scoliosis po is covered up to 40,000. As I discussed earlier po, for the 4S, for the back or spinal problem po, scoliosis, spinal stenosis, spondylosis po, and slip disc are covered up to 40,000 pesos of our maximum benefit limit po. Okay. So everyone, any more questions? I think none. So again, in behalf of Howden team and Cocolef Healthcare team. So again, this is Manuel Victor Villar, training officer of Cocolef Healthcare. I do like to thank HMO and every one of you for attending this orientation. I hope the orientation po we conducted enlighten you, clarified your clarifications po with your benefit coverage with Cocolife. Again, everyone, thank you for listening po. Stay safe in this pandemic po. Mag-ingat po tayo lagi. Thank you everyone. Have a good day po.
Thank you
Thank
very
you,
much,
Vic.
Thank
Mr.
you.
Villar. Thank you
Thank
very
you.
much.
Thank you, everyone.
So,
you.
at this juncture, we would like to call on our FEMAC chairman, Dr. Arturo De Leon, to give us the closing remarks.
Thank you very much, Kay. A pleasant morning to all of us here in this orientation forum. First of all, I would like to thank the Our Lady of Fatima University through the Human Resource Department for conducting this employees benefit orientation. We'd like also to thank Team Howden and the Coco Life team, healthcare team, for giving those vital information regarding the coverage of our first ever benefit on HMO. And of course, I would like to thank the administration of the university and the hospital for finally coming up with this kind of benefits, which we have been rooting for since the conception of PEMAC. This only shows that everything can be discussed, everything can be raised up, and everything can be finally done out of the caring for each of one of us. This is just an orientation, initial orientation, and your presiding officers will be available to further inform you of your of any inquiries that was not raised in this forum. Again, Sir Don, on behalf of the men and women of the Our Lady of Fatima University and Fatima University Medical Center, we'd like to thank you and the Board of Trustees for giving us this Christmas gift, a unique Christmas gift, a healthcare benefit gift to each one of us. I know that we did not hit the mark, and still the Board of Trustees decided to shoulder half of the premium. For that alone, we would like to give you our deep sense of gratitude. To everyone, let's continue to share this blessing among us. Thank the Lord, thank the university, and always live up to the real meaning of or essence of FEMAC. Firstly, everyone must always care. A happy day for everyone. Thank you very much for your time. Good day, everyone.
Thank you, sir.
Thank you, Dr. De Leon. At this juncture, we would like to thank our guest speakers from Howden and Coco Life. Again, maraming salamat po for sharing us details, vital information about the HMO to be provided to our employees. Maraming salamat po. And on behalf of the administrators, we would like to thank everyone for joining us this morning, to our deans, program heads, department heads, from both Our Lady of Fatima University and Fatima University Medical Center. Maraming salamat po. And of course, special thanks goes to RDIC for helping us in the technical aspect of this orientation. Maraming salamat po. Have a good day, everyone. But before we end, may I request a picture taking for the documentation of this event. Thank you.
Okay, good morning.
Good morning po, Kap.
Alam mo na natutuwa ako. Wala pa lang wala pa lang age limit.
Age limit po. Sir, Kap, actually po, the coverage of the benefits would include po all full-time faculty members, 1 year, full-time faculty member na 1 year na sila or 2 consecutive semesters, or regular non-teaching employees and regular FEMC employees age 65 years and below. But for those who are already seasoned faculty members and members of the workforce of OLFU and FEMC, the premium po will be paid by the whole premium po will be paid by the employee na po, Kap.
Yeah, kaya nga tuwan-tuwa nga ako eh. Ang sinabi ni Mr. Villar, young ones. Eh, ang spelling ko ng ones kasi, O-N-C-E. Ah, di ba?
Young ones.
Oo, kaya walang age limit eh. Kasali pa rin ako. Diba?
Yes.
Thank you, Sir Don. Thank you po. Maraming salamat po. Merry Christmas po sa inyong lahat.
Thank
Thank you, Kap. Joseph, can we have a group photo?
Sep, can you can you unshare the